In August of 1966, our nation was shaken by the tragic events that unfolded on top of the Texas Tower. Picture this. Charles Whitman, a young man once beloved by his community, was driven to commit the unthinkable as he opened fire on the unsuspecting pedestrians below. But what if I told you that behind Whitman's violent rampage was not merely malice, but a silent culprit lurking within his own brain? A growing tumor had resulted in abnormal aggression, causing him to act erratically with little control over his actions. This is where forensic psychiatrists come in. These healthcare professionals apply their background in psychiatry to create justice. Had Whitman been alive to face court, a forensic psychiatrist would have declared him unfit for trial and instead sent him to a mental institution. This testimony would have saved him from spending years in prison and gotten him the treatment that he truly needed. My name is Sara, and welcome to my presentation on forensic psychiatry. I'm a rising senior at Westview High School based in Portland, Oregon, and I've always been passionate about both criminal justice and global health. Throughout high school, I've conducted research on various mental health conditions, which sparked my interest in psychiatry. Additionally, I'm the secretary of HOSA and placed top 10 in the world for the Health Career Display event, where I presented with a partner on forensic psychiatry. This was where I had the opportunity to interview Dr. Octavia Choi, a board-certified forensic psychiatrist from Stanford University, to further understand the true experience of this career. I was compelled to research forensic psychiatry because it's a unique career that bridges the gap between law and medicine. And more importantly, forensic psychiatry gives us the power to make a larger impact on public health by advocating for vulnerable populations. To treat patients like Whitman, forensic psychiatrists start a comprehensive process in a clinical setting where they interact with patients and conduct psychiatric evaluations. Afterward, they work in diagnosing patients and preparing reports to present in court. And finally, they provide expert testimony that determines whether the patient is sentenced to a hospital or prison. Now, you may be wondering, when do these professionals apply this process today? One famous case that Dr. Choi worked on was the case of Anthony Montwheeler in 2016. Montwheeler had been convicted of first-degree kidnapping, assault, and 2 murders. However, the judge ruled that Montwheeler was not competent to stand trial because he was deemed criminally insane from hearing voices. As a result, he was sent to a mental institution instead of a prison. Frustration from the national community arose when Montwheeler was even allowed to leave the hospital, putting the public at great risk. Shortly after his release, he kidnapped one of his ex-wives and stabbed her to death. This was where Dr. Choi stepped in. As a forensic psychiatrist, he played a significant role in protecting us from the threat of a criminal. He conducted an evaluation on Montwheeler and concluded that he had been faking his symptoms so he could evade punishment. However, forensic psychiatrists must look at both sides of the story. Dr. Choi also considered that Montwheeler did in fact have depression, which significantly impaired his ability to make rational decisions. By considering public safety while empathizing with his condition, he recommended sending him to the state hospital for a few months before standing trial with full mental competency. Even though Dr. Choi claimed he was not a mind reader, Montwheeler later revealed that he had in fact been fooling the system for almost 20 years. Had a forensic psychiatrist not intervened, Montwheeler would still be roaming free today, putting us at the mercy of a dangerous criminal. Many forensic psychiatrists feel fulfilled in protecting the community and helping their patients receive proper care. In addition to speaking to Dr. Choi, I interviewed Dr. James Armentrout from Stanford and Dr. Wade Myers from Brown to understand just what it's like to serve global health through law. All 3 of them reported the same high levels of job satisfaction. This comes from a strong sense of justice and accomplishment, especially when addressing the current global mental health crisis. According to the World Health Organization, 1 out of 8 people globally live with a mental disorder, and people with severe ones can die up to 20 years earlier. As this growing pandemic is now being acknowledged in the global health community, forensic psychiatrists have a growing relevance in aiding the treatment of those in need. Individuals like Dr. Armentrout, Dr. Myers, and Dr. Choi play a critical role in delivering justice to society through medicine. Beyond the stories of these passionate professionals, I was captivated by this career because of its unique interdisciplinary nature. Even though law and public health seem like two very distinct fields, they overlap in ways we don't expect. While playing a strong role in the justice system, forensic psychiatry aligns with the broader healthcare system as it advocates for the treatment of patients in need. Think about Charles Whitman and the hundreds of victims who suffered his attack. But also think about the lives they could have had if his mental health condition had been addressed earlier. Think about Anthony Montwheeler and the innocent lives he stripped away. But also think about how different the outcomes would have been if he had been evaluated by a forensic psychiatrist and sentenced appropriately from the beginning. Although injustices still plague our society, forensic psychiatrists address this issue by delving into both sides of the story, advocating for public health and safety on a scientific basis. As our understanding of mental health continues to expand, it is critical, now more than ever, that crimes are evaluated through the lens of psychiatry. The next time your news headlines flash with another true crime case, think about the impact forensic psychiatrists leave on society, linking mental health and justice to protect vulnerable populations. First, I'd like to thank Yolini Gopalswamy and Sara for working with me on this research project. I'd also like to thank Johns Hopkins University for giving me the opportunity to shed light on this topic. I would also like to thank Dr. Armentrout and Dr. Myers for giving me the opportunity to interview them. I'd also like to thank Dr. Choi for not only offering his detailed insight, but his enthusiasm and continuous support for my exploration of medicine. And of course, I'd like to thank you for listening. If you enjoyed this presentation, feel free to connect with me through my email or LinkedIn.